everything you wanted to ask about sex but didn't. Now you can ask Dr. Leah, sexual health expert and assistant professor in the Department of Health and Human Performance. Here she is, Dr. Leah.
Thank you. It's great to be here with all of you. Now let's get right to the first question.
Dr. Leah, a male college student, writes, I have a crush on my male friend, and it's developed into a feeling of deep love. This has really caught me off guard, and I'm wondering if these feelings mean I'm becoming gay. I've only dated women in the past.
Not necessarily. I mean, you're human. You could have all kinds of crushes on all kinds of people for all kinds of reasons. I really wouldn't be so concerned about the label. Perhaps you admire this guy for some reason, and that's emerging as some sort of crush. Maybe he represents something that you would like or aspire to be. This doesn't necessarily mean that you want a relationship with him. Sexuality and romantic orientation are very complex, and I find these labels to be rather limiting and oversimplified. I see a couple possible scenarios here. Even if you have a pattern of being predominantly attracted to women, it could happen that occasionally you're attracted to a man. Or maybe this is just one of those exceptions to the rule. Some people who are always attracted to one gender or the other still might identify as either straight or gay rather than bi or pan. So I would focus on why you're so concerned about the title. Did you grow up in a heteronormative home or possibly even a homophobic environment? We simply just can't help how we feel about someone. We can't control those immature knee-jerk reactions and responses to situations that we have. So labels are originally meant to put people in little boxes, and humans are just way too complicated for that. Next question, please.
Dr. Leah, next up, a 50-year-old man writes, I have always had great sex with my wife, but after we're intimate, I have a major loss of libido, which lasts a few days to a week. What is going on here?
It's really common to worry about whether or not you're having enough sex, especially in our culture that's so concerned with sex and competition. Whatever amount of sex you're having, that's okay as long as you and your spouse are happy with the frequency. If you're in a super happy marriage and you're both satisfied, rarely having sex, but as long as you're connecting in other ways, that's perfectly fine. If you're sexually satisfied, but you're concerned that your wife is not, then just ask her that question directly. Say, I don't have a problem with the amount of sex we're having, but I just want to make sure that you feel good about your sex life, and see if there's things that she would like to change. But maybe she's satisfied and there's nothing that needs to be changed. Just remember, there's a really wide range spectrum of what is normal sexually. However, if you're really worried about increasing your sex drive, increasing your exercise and testosterone levels will help. There's also testosterone increasing medications. Just remember, decreasing testosterone is a normal part of aging. Your testosterone levels decrease, but that also causes your desire for sex to decrease. So there are medications that can increase your testosterone, amp up desire, amp up orgasm frequency. Just talk to your doctor if you feel like this will be an issue. That men's sexual peak occurs in their late teens, while a woman's sexual peak doesn't occur until her mid-30s. Well, we are here to set the record straight.
There are no magic ages when men and women are their best sexual selves. Experts say this idea simply doesn't hold water. There's no biological time frame in which nature dictates that sex is no longer for you. However, sexual peaks should not be confused with reproductive peaks, the time best suited for having children. This does exist, but unlike most other species, humans don't have sex just to reproduce. Sex is primarily about bonding, and that's something that we crave our entire lives. The good news is, for most people, sexual desire ebbs and flows, and it has little to do with age alone. It can change depending on how busy you are, how healthy you are, and if you're getting along with your partner. Experts also agree that you can feel desire at any age, and since sex is psychological as much as it is physical, the best way to stay in tune with your sex life at any age is to invest in your physical and mental health. When you feel better, it stands to reason that everything gets better, including your sex life. Our next question comes from a man in his mid-20s. I've been dating a woman for a few months now, and we're ready to have sex. Only problem is, I'm a virgin. I'm scared to tell her, and unsure if this will change her feelings. What should I do?
If you told your partner that you are not a virgin, then I could see how telling them that you are a virgin might seem like a stressful moment. On the other hand, if you're simply stating it for their information, it really doesn't have to be a huge deal. Especially depending on your age and your situation, this might be positive news. Just remember, your virgin status is your own business. You don't have to share it with anyone if you don't want to. They might already know, but many younger people or people within certain cultures already assume that you're a virgin. If this is true, then telling your partner will merely be a confirmation of what they're already assuming. If this is the case, or if your partner seems a little uncomfortable talking about sexual topics, make sure you're in a one-on-one conversation, make sure you have their full attention, and you could just say something like, I feel like we're getting close to having sex, so I feel comfortable telling you that I'm a virgin. When you phrase it like that, it doesn't put any expectation on your partner to react a certain way. You're simply presenting a fact. If you think your first sexual experience is going to happen soon, letting your partner know you're a virgin can be a courtesy, but it can also open up an important discussion about sexual history, which is something you're going to want to know before you become intimate with someone. So just set aside a time to have a private conversation when you bring up sexual history. Like something along the lines of, I think it's important we talk about our past since it seems like we're going to have a future. This conversation hopefully will present a natural opening where you can reveal your virginity in a way you feel most comfortable. In case the person says, why didn't you tell me before? You could simply say, I didn't really think it was your concern, or you didn't realize you were ready for sex yet. If the person says, why haven't you had sex before? Your response obviously is going to depend on the truth, but you could say, I never wanted to, I didn't have the opportunity, just waiting for the right person. All of these are perfectly acceptable answers. Just be honest about how you feel, even if how you feel makes you feel vulnerable. So tell your partner, I'm nervous, I'm happy, I'm anxious, I'm all these things at once. If your partner knows where you're coming from, she'll probably be more likely to respond in a way that makes the experience better and more comfortable for both of you. And finally, if you don't feel comfortable telling your partner about your virginity, this might be an indication that this isn't someone with whom you should lose your virginity. Next question, please.
A young woman wants to know, is a cold sore the same as herpes?
Herpes is actually categorized into two different types of categories. So there's herpes type 1, which is oral herpes, and herpes type 2, which is genital herpes. Most commonly, herpes type 1 can cause the sores around the mouth and the lips. Sometimes people call them fever, blisters, or cold sores. Herpes type 1 can cause genital herpes, but most of the genital herpes cases are caused by herpes type 2. In HSV2 or herpes 2, the infected person may have sores around their genitals or around their rectum. Although herpes 2 sores may occur in other locations, these types of sores are generally found below the waist, not in the mouth. There are other types of sores around the mouth called canker sores, and they should not be confused with herpes. These are small, round ulcers that appear inside the mouth. They are not contagious. Often these are caused by things like food allergies, stress, sometimes infections, or vitamin deficiencies.